Negotiators in Geneva finally wrapped up talks at dawn, and world leaders have agreed to share pandemic vaccines. The big question is, when the next crisis hits, will this system actually hold up?
It's May 31st, 2025. Let's get right into it. After 3 years of negotiations, countries have come together under the World Health Organization to strengthen pandemic preparedness. Why now, and what's actually changing?
In short, COVID-19 showed us the cracks in the system. There was vaccine inequity, countries acting on their own, and not enough fast, coordinated action. This new agreement aims to fix those problems. It makes international collaboration and transparency legally binding. The hope is that next time, every country, no matter how wealthy, gets what they need.
Let's unpack the details. The first big point: equitable access. Manufacturers are now required to set aside 20% of their real-time pandemic vaccine and treatment production for global use, focusing on places in greatest need. But how is this enforced? What happens if a company or a country says no?
That's where the Pathogen Access and Benefit Sharing System, or PABS, comes in. It connects access to virus samples and data with company obligations. If manufacturers want to participate globally, they must agree to that 20% allocation. There are incentives, like market access and partnerships, but also oversight by WHO and this new body, the Conference of the Parties, or COP.
So the COP isn't just there to talk. They actually check if countries and companies are meeting these commitments?
Exactly. The COP monitors whether everyone is keeping their promises, especially on equitable resources. If a country falls short, the conference can review the situation, suggest improvements, and offer technical help if needed. It's more than just peer pressure, but there aren't hard penalties. Countries still keep their sovereignty.
So the WHO can't override any country's laws or force them to take specific public health steps?
That's right. The agreement specifically protects national sovereignty. WHO and COP can guide, support, and recommend, but not mandate what a country does inside its own borders.
What about beyond vaccines? Are there clear steps to help lower-income countries?
Yes, the agreement also covers technology transfer, technical assistance, and financial support. These are all voluntary and must be mutually agreed. The idea is to strengthen health systems and train staff so no country gets left behind next time.
Do we know how this will play out? Are there going to be stockpiles, or are we talking mostly about promises of support?
There's more structure now. The agreement creates a global supply chain and logistics network to help remove obstacles to access. The COP oversees this as well, so resources should move quickly to where they're needed most.
That all sounds promising, but what keeps countries from just signing and then ignoring their commitments? What if a country doesn't share or distribute vaccines as agreed?
That's the COP's role again. They monitor, investigate, and if there's a problem, offer support or suggest corrective steps. It's not a court, but it does add accountability and a sense of shared responsibility.
And the pharmaceutical companies? In the past, some haven't wanted to share data or manufacturing capacity. Is there any real leverage now to make sure they're on board?
Participation is tied to access. If companies want to be part of global research or sell into markets covered by the agreement, they have to commit to sharing 20% of real-time output. The PABS system works here, using market incentives rather than legal penalties.
So this is about incentives, transparency, and peer accountability, not strict enforcement. Is that enough to make a difference?
That's the key question. The new agreement is definitely stronger than what existed before, and it allows for adaptation as new threats come up. Still, it all depends on political will and keeping public focus on the issue.
To sum up, the world has its first comprehensive pandemic preparedness framework now. It aims for equity, collaboration, and real accountability, but ultimately relies on cooperation and shared interest. Could this reshape global health, or will we fall back into old patterns during the next crisis?
That's something only time will show. The commitment is real, the tools are new, and the risks are significant.
That's our look at the new WHO Pandemic Agreement. Thanks for joining us as we unpacked what could be a major turning point for global health.
We'll keep following the developments. Thank you for listening. This episode was brought to you by mynews.studio. Try it free.